Hello everyone, and welcome to the Diabetic Toolbox, where we are on a mission to end type 2 diabetes one family at a time through education, support, and empowerment. If this is our first time meeting, my name is Renee. I am an emotional eating and diabetes lifestyle coach and yoga teacher, and I help adults over 40 with prediabetes or type 2 diabetes to lower their blood sugar, lose weight, and improve mobility without extreme dieting or spending hours a day in the gym. Today, we are talking about diabetic retinopathy, what it is, how it develops, and I'm going to give you 3 simple ways that you can start today to protect your vision if you've been diagnosed with prediabetes or type 2 diabetes. Most often, when people think about diabetes, they think about blood sugar levels, medications, or what they should eat. But eye health, although not at the top of the list, should be. Your eyesight is something that you rely on every single day, and diabetes can affect your eyes long before you notice any changes in your vision. Diabetic retinopathy is one of the most common diabetes-related eye conditions. It develops when high blood sugar damages the tiny blood vessels in the retina, which is the light-sensitive tissue at the back of your eye. After a while, these blood vessels can weaken, leak fluid, or become blocked. As the condition progresses, new fragile blood vessels may form, increasing the risk of bleeding, scanning, and vision loss. One of the most challenging things about diabetic retinopathy is the fact that it often has no symptoms in the early stages. You may feel that your vision is perfectly normal while changes are quietly happening inside your eyes. That is why routine eye care is so important for anyone living with prediabetes or type 2 diabetes. But I don't want you to fret or be afraid, because I do have some good news for you. There are practical steps that you can take to help reduce your risk and protect your eyesight. First up, keep your blood sugar as stable as possible. No one has perfect blood sugar every single day, and that's okay. The goal is to make progress every single day. Consistently working towards healthy blood sugar levels can reduce stress on the tiny blood vessels throughout your body, including those in your eyes. Small habits like eating balanced meals, staying active, taking your medications as prescribed, and monitoring your blood sugar can make a big difference. Secondly, schedule your annual diabetic eye exam. I cannot tell you how many folks I talk to every day, and when I ask them about routine eye exams, they have not had one in 2, 3, one client told me 5 years. Even if you can see clearly, an annual comprehensive dilated eye exam is one of the best investments you can make in your long-term health. These exams allow your eye care provider to detect changes before they begin affecting your vision. Early detection often leads to more treatment options and better outcomes. If it has been more than a year since your last exam, please consider scheduling one today. The third thing I want you to do is to pay attention to changes in your vision. Don't ignore symptoms such as blurry vision, difficulty seeing at night, or an increase in floaters or flashes of light. Or some folks experience dark areas in their field of vision. Please do not chalk this up to age. And because these symptoms do not always mean that you have diabetic retinopathy, but they should not be ignored. So contact your health provider or your eye care doctor as soon as you can when you notice the changes. Don't let them continue for weeks or months thinking that they're going to take care of themselves, because 9 times out of 10, they won't. So, what's your next step? To help you prepare for your next appointment, I've created the Diabetic Toolbox, 5 questions to ask at your next diabetic eye exam. Inside, you'll learn the 5 questions to ask, what warning signs to watch for, and how to become a stronger advocate for your long-term eye health. This guide is a great resource whether you have been recently diagnosed with prediabetes or you've been managing type 2 diabetes for years. The guide will help you to walk into your next appointment feeling informed, confident, and prepared. You can download your copy of the 5 questions to ask at your next diabetic eye exam by clicking the link in the show notes. All right, my friend, that is all I have for you today. Please share this podcast episode with someone you love. And until next time, take care of yourself and each other and schedule that eye exam today. I will talk to you soon. Bye for now.